Welcome to Crash Cart Nursing, the podcast where we help resuscitate your nursing education one topic at a time. I'm Nick McAllister, registered nurse specializing in emergency medicine and professor of nursing. Today, we're diving into the fascinating world of mental health nursing. In this episode, we'll take an in-depth look at the essential concepts that form the foundation of mental health care. Get ready for a blend of insights, real-world applications, and a sprinkle of information to keep you motivated. Let's kick things off. Foundations are everything, right? This episode lays the groundwork for understanding mental health nursing, where we explore everything from basic concepts to ethical dilemmas, effective communication, and stress management. It's all about equipping you with the tools to provide compassionate, competent care. Let's start with a big one. What exactly is mental health? Think of mental health like balancing plates, each representing emotional, social, and psychological wellness. If one plate wobbles, the others are affected too. Mental health isn't just about avoiding illness, it's about achieving harmony. And nurses, you play a huge role in maintaining that balance for your patients. Remember, we're not just caregivers, we're advocates, champions of wellness, and a vital link to better outcomes. Let's put this into perspective. Imagine you're taking care of a patient who's lost their job and is experiencing severe anxiety. They're unable to sleep, have lost their appetite, and feel overwhelmed. Your understanding of mental health isn't just academic, it's the lens through which you can assess their needs and connect them to the right resources. By addressing their mental health, you're helping them regain balance in their life. One of the cornerstones of mental health nursing is understanding the legal and ethical responsibilities. Let's talk about HIPAA. That's the Health Insurance Portability and Accountability Act. That's the law that helps us keep patients' information confidential. Picture this. You're caring for a patient who confides something deeply personal. Later, a family member asks about it. What do? Here's the thing. Confidentiality is sacred. Legally, you can't share anything unless the patient gives you explicit permission. Ethically, it's about protecting the trust they've placed in you. Trust is the currency here, and breaking it can have serious repercussions for the therapeutic relationship. Let me give you another scenario. You overhear a colleague casually discussing a patient's condition in a break room. What's your role here? Advocacy doesn't stop with patients. It extends to ensuring ethical practices within your team. Always remember, confidentiality isn't just a rule. It's a cornerstone of professional integrity. Another legal consideration is informed consent. This applies even more critically in mental health, where patients may struggle to understand their treatment options. It's your responsibility to advocate for their understanding and their rights, ensuring that they have the support they need to make informed decisions. Let's talk communication. In mental health nursing, therapeutic communication is like having a superpower. Techniques like active listening, reflecting, and asking open-ended questions aren't just skills, they're bridges that connect you to your patient's world. One encourages further communication, while the other is closed off. Imagine a patient struggling with anxiety. They might not vocalize their distress, but nonverbal cues like tapping fingers or avoiding eye contact can speak volumes. By staying observant, you can gently probe in a way that feels safe and supportive for them. Remember, your tone, body language, and timing are just as important as your words. Effective communication can turn a moment of hesitation into a breakthrough for your patient. Let's dig deeper here. Communication isn't just about building trust. It's about navigating conflict too. Say a patient is frustrated and lashes out verbally. Instead of reacting defensively, you might say, "I can see you're upset. Can you help me understand what's going on?" This approach diffuses tension and opens the door for meaningful dialogue. Small changes in your communication style can lead to significant improvements in patient outcomes. Coping mechanisms and defense strategies. Defense mechanisms. These psychological strategies help people shield themselves from anxiety. Some, like humor, are adaptive and can lighten the emotional load. Others, like denial, can become barriers to healing. For example, a patient might downplay their depression by saying, "I'm just a little tired. It's nothing." Recognizing these mechanisms is your first step to guiding them toward healthier coping strategies. It's not about confronting patients, it's about helping them understand their behaviors. Once they're aware, they're better equipped to make positive changes. Your empathy and guidance can make all the difference. Let's consider a specific example. Imagine a patient who uses avoidance as a coping mechanism. They avoid discussing their trauma because it's too painful. Your approach might include introducing the topic gradually, using therapeutic communication to create a safe space for them to explore their feelings at their own pace. Over time, you can help them transition from avoidance to active problem solving, a shift that's essential for their recovery. Let's talk about creating a therapeutic environment. This means ensuring the setting is physically and emotionally safe. Factors like noise level, personal space, and cultural sensitivity play a huge role. For instance, a chaotic ER might overwhelm a patient with PTSD, that's post-traumatic stress disorder. Adjustments like providing a quiet room or dimming harsh lights can create a space where healing feels possible. We call this creating a therapeutic milieu. Remember, safety isn't just about the physical environment. Emotional safety means fostering trust, setting clear boundaries, and respecting each patient's unique journey. A therapeutic environment is where patients feel seen, heard, and valued. Here's another aspect to consider: community resources. Patients leaving your care might not have immediate access to a safe environment at home. Part of your role is connecting them with support networks, shelters, or outpatient programs. This proactive approach ensures they continue to feel supported and safe even after they've left your direct care. In addition to these community resources, it's also important that we make sure that our patients understand that follow-up is a crucial part of their recovery. If your patient gets out of being an inpatient at a mental health facility and they don't have follow-up that they keep, that can be a detriment to them and they can end up getting rehospitalized for the same mental health issue or worse. That wraps up today's episode. We've covered a lot, everything from foundational concepts to ethical responsibilities and the art of therapeutic communication. Remember, as LPNs, you're not just caregivers, you're advocates, communicators, and sometimes the lifeline for patients navigating their mental health. Don't underestimate the impact you have. If you're enjoying this series, be sure to subscribe and comment. It helps us reach more learners like you. Until next time, keep learning, stay compassionate, and take care of yourselves. You're doing amazing work out there. See you soon.